Welcome back to another episode of Medicare Unscripted. I'm Kaylee Terbovich, Director of Medicare Operations at Secure Money Health. On this podcast, I break down real Medicare situations, common mistakes, and what you actually need to understand so you can make confident decisions about your healthcare coverage. Because when it comes to Medicare, it's not usually what people don't have, it's what they don't realize they're missing. So let's get into it. So let's start with a real life scenario to put this into perspective. So picture this. You just purchased a beautiful home. Fresh paint, new floors, everything looks perfect. And then one day you notice a small crack in the ceiling and you ignore it. But a few months later, that crack turns into water damage. Now you're dealing with drywall, mold, repairs, and thousands of dollars in costs that could have been avoided if you addressed it earlier on. That's exactly how many people approach Medicare coverage gaps. They assume everything is fine until a small issue turns into a very expensive problem. And most of the time, that crack is something people don't even realize exists. So let's break down what that actually means when it comes to Medicare. One of the biggest things people don't plan for is the 20% exposure that Original Medicare does not cover. So Original Medicare, which consists of your A and your B, generally covers 80% of approved services. That means you are responsible for the remaining 20%. And here's the part most people don't realize is there is no cap, which means there is no maximum out of pocket on how much money you would be subjected to pay. So if you have chemotherapy, extensive outpatient surgeries, or ongoing treatments or infusions, that 20% can add up very, very quickly. People hear Medicare covers most of it and feel comfortable, but Medicare does not cover all of it. And that remaining portion is the crack in the ceiling. So if it's small, it may be manageable. However, if it's large, it becomes a renovation that you never planned for. So let's do a quick round of myth or mistake and clear up a common misconception. So here it is. Original Medicare protects me from large medical bills. That is a mistake. Original Medicare protects you from paying 100%, but it does not protect you from the unlimited 20% coinsurance. And that's why people explore options such as Medicare supplement plans or Medicare Advantage plans. So the key here is not fear, it's understanding your exposure. Now, let's talk about why this matters even more today. Healthcare costs are rising, and hospital costs in particular are rising faster than general inflation. So between 2015 and 2022, hospital prices increased more than 30%. And general inflation during that time was closer to 20%. So what does that mean for you? It means that 20% of a bigger number is still a bigger number. Even though the Medicare system itself hasn't drastically changed, the cost of healthcare has, which makes understanding your coverage and your gaps more important than ever. And this ties directly into a question I get all the time. And that's, if Medicare pays 80%, why would I need additional coverage? And it's a great question, but it really comes down to your comfort of risk. Some people are okay taking on that 20% exposure, but others want more predictability. The most important thing is that you understand your options, and there are plans that are available that help absorb these costs, often at a relatively low monthly premium. Whether that's a Medicare supplement plan or a Medicare Advantage plan, you have options. This isn't about expecting something to go wrong. It's about being prepared if it does. So just like home insurance, you don't expect a flood, but you will be prepared if there is one. So what's the takeaway here? Let's go back to that home scenario. The small crack wasn't the real problem, but ignoring it was. And that's what happens in Medicare every single day. So here's the preventable problem of the week. Assuming Medicare alone eliminates financial risk. If you are currently on Original Medicare and unsure what your exposure looks like, here are a few things to review. Do you have a supplement plan? Do you have a Medicare Advantage plan? And what is your maximum out of pocket on that? What would 20% of a major procedure cost look to you? Planning doesn't create fear, it creates peace of mind. Because in Medicare, small cracks can turn into very expensive renovations. If you found this helpful, share it with someone who's approaching Medicare age or who's already enrolled and ensure what their coverage really looks like. You can always visit us at securemoneyhealth.com for more information. I'll see you next time on Medicare Unscripted.